Let's continue. We're asking the question, how has the NHS failed you? I mean, it's a broad question. People will have their own experiences as to what might have happened in that respect. But certainly the Health Secretary has got his own views on this at the moment. Says he'll hold hospital bosses to account for what he sees as failures. I mean, you'd hope that would sort of happen anyway. I know there's often sort of a bit of a... Is it a standoff between the clinical side and the managerial side? I would imagine some people on the clinical side sitting there open-mouthed at times, wondering what the heck is going on. They've announced a new league table that could lead them to losing their jobs if they fail, these managers. Wes Streeting's new system will see NHS trusts ranked on things like their finances and patients' access to care, with bosses at the worst-performing trusts facing the sack. Let's speak with Rob Galloway, A&E consultant. Good afternoon to you, Rob.
Good afternoon, thank you for inviting me.
Pleasure. I mean, you kind of hope that if somebody is that bad at their job, in the managerial sense, they wouldn't be hanging around. But I'm assuming that, according to Mr. Streeting, too many of them are.
I think it's a very, very simplistic view, is saying league tables will solve the problem. There's unintended consequences of league tables. As we had it under the last Labour government, where they brought in the 4-hour target. A good idea to try and get patients to be seen quicker, but things were gained. For example, when I was a junior doctor, patients were being moved out of A&E before their full treatment just to get up the league table. And we've got to be careful about thinking that league tables are going to do ultimately what's important, which is improve patient outcomes. Yeah,
it's a very good point. I remember my own experience of that was when my mum was having breast cancer surgery and sitting with the surgeon, who I couldn't believe it, literally pulled out a paper diary to check the date. He said, "I've got to do this op in a certain amount of time." And I said, well, how do you do that? And he said, well, essentially cancel somebody else's, or certainly move it around. And you're right, it was never that straightforward, and you sense this could be much of the same problem.
Yeah, and also it's simplification of an incredibly complex situation. So I work in A&E, and we've got patients waiting days, genuinely days, 2-3 days for a bed. It is, we've stopped caring for our patients, in all honesty, because care is with dignity. We're treating patients in corridors. And if you looked at what we're doing, we would be at the bottom of the table. But we actually see patients very quickly. We see them in an efficient way as A&E doctors, but they then can't move out of the A&E department. And they can't move out of the A&E department because there's no beds in the hospital, and there's no beds in the hospital because of lack of social services. So you all put us at the bottom of the table, but actually it's got nothing to do with what's going on in A&E. It's got to do with what's happening in the wider community. So
it's the kind of, so when somebody's waiting for 9 hours or something, as we hear in A&E, it's the blockage is kind of not with you guys at the coalface, it's elsewhere that's holding it up.
I wish my patients would only wait 9 hours in A&E. They wait a lot longer on average for a bed. So we see them quickly, but they are waiting for days, genuinely days in a corridor. We have come to accept the unacceptable. Wes Streeting needs to come and do a night shift with us in A&E to see what it's like. I'd like to put that request out there. Come and see what it's actually like on the coalface, because I've worked in A&E since 2001, and I've never known it so bad. The staff are suffering, the patients are suffering, and a league table is not going to solve it. We need a root and branch reapproach to, we always talk about, 40,000 more appointments. What we've got to do is actually reduce demand. It's not about more appointments, more things like that. It's about reducing demand. And I think they need to really see what it's like on the coalface.
Yeah, and I guess just lobbing a tax on sugar, which is kind of one of those initiatives that's meant to ultimately reduce demand. I mean, that's a wider thing outside of A&E, but you take the point. It's that is that the kind of thing you're talking about, or is there something else that should be done? I mean, there's another 23 billion quid coming your way, Rob.
Absolutely, but what worries me is that money isn't going to go on prevention, it's going to go on to treatments. I spend my time in A&E looking after patients once they've got sick, and I've come to realise that actually the money shouldn't be with me, but it should be in prevention. And if you look at this sugar tax, absolutely, I totally support that. We need to change lifestyles because people are getting more and more unhealthy. And the response is, oh, let's give them a fat jab, one of these Wegovales. Actually, we need to tackle the root cause. And the root cause is our unhealthy lifestyles. And absolutely, people who say, oh, it's nanny state, the only people who really moan about the nanny state are people who've had nannies themselves. We actually need to encourage proper taxation to look after our population, because the current situation is failing.
But is that, I mean, notionally I understand that, and it kind of makes sense. You know, if everybody looked after themselves, that would be great. You know, if I didn't play Sunday morning football, I wouldn't damage my shins and wouldn't have to go to A&E.
Rubbish, because football and sport is so good for you. The tiny disadvantages of an injury are nothing compared to the wellness of...
But is there not... I mean, what again, notionally, it sort of makes sense, Rob, but are we not talking there about something that would take several generations to kind of permeate through to get everybody fighting fit and healthy? I know you'd only want, you know, a 10% drop in people getting ill would be a massive boost for NHS efficiency, but to get to that is, I mean, that's climbing mountain territory, right?
We need to start now. But also, if you start changing diets, you can actually make significant impacts on things like type 2 diabetes. So the problem is we've got so much dogma in how to treat medical conditions. About type 2 diabetes is the drug companies, big pharma, has overtaken common sense, and it's always drugs, drugs, drugs. But actually, if you have a very, very, very low carb diet, you can reverse type 2 diabetes within a few months. But we've never had that way of thinking. We've always had the traditional dietitians giving the advice, which is 20 years out of date. So actually change the diet can make an impact within 3 months. The money needs to be spent on that type of thing rather than more appointments. Yeah,
I'd certainly agree with that. I spoke to a consultant quite recently who said that, you know, diabetes alone could bankrupt the NHS. I mean, it's and the knock-on effects of it, and yet it's something, as you write, type 2, of course, that is preventable and reversible.
It's preventable and reversible, and I'm a massive believer in the NHS because the NHS, the ethos of it is doing what's right for patients, not profit. The problem is it's becoming unmanageable because of this tidal wave of unhealthy living. And we can't cope. No system can cope. It's much more efficient than the American system. In America, they spend double what we do on healthcare, and their outcomes and their life expectancy is a lot worse. But the thing we've got to remember is since the last few years, we've seen, and it happened before COVID, this is not related to COVID, we've seen a drop in life expectancy for the first time ever. We are getting less healthy than our parents.
And of course, just on that point of, sorry to dwell on the diabetes thing, but the knock-on effects, you know, heart disease and all sorts of other cancers and all sorts of other issues that can ultimately, that's the area that if you reduce that, then you guys at the coalface would have a far more efficient system in A&E.
Completely. When I started, we would look after the injuries, the acute infections. Now it's these 4 horsemen of these chronic conditions, and it's all related to the metabolic diseases of too much sugars in many ways. So diabetes, but Alzheimer's can also be known as type 3 diabetes because poor glucose control really affects dementia. So then you've got dementia, you've got diabetes, you've got cardiovascular problems, all again related to metabolic syndromes, and the rise in cancer. We are seeing increasing levels of cancer, even in the young. Take bowel cancer, gone up 2% a year the last few years.
Wow.
All because of environmental and lifestyle factors.
Yeah. Will the 23 billion quid assist in any way, Rob? I mean, Wes Streeting has talked about lifestyle factors. We've done a few phone-ins on that, and, you know, whether people call it the nanny state or whatever they want to call it, he's at least acknowledged the point you're making.
I completely agree. We need to start doing it, but, you know, health policy needs to be involving farming, involving schools, involving transport. So it's the proof in the pudding. Let's look at the budget. I'm delighted that they put in the money for the NHS, but they also increased bus fares by 50%.
Yeah.
So you've got elderly people who are going to be stuck in the house.
Crazy, right?
Is a massive risk factor. Then they won't walk out. So you get sarcopenia, it's called, where old people aren't exercising. So the proof is in what they say. The cut in the winter fuel allowance is just going to add to the burden of the NHS. So yes, you can say, give us with one hand, but actually it's about social policy.
Yeah.
And these policies are the most un-Labour policies you can imagine.
Yeah.
I'm confused by them.
I mean, I normally hate that phrase, joined up thinking, but for the purpose of this, they've completely failed on that one, haven't they? And you've just given a couple of examples as to why.
Yeah, so I in many ways I support what Wes Streeting is doing, but it is not being joined up in terms of how to prevent problems, because we're all about these 40,000 extra appointments, or whatever, about preventing NHS problems in the first place.
There it is. Listen, Rob, we'll let you get back to it. Thank you, sir. Great to have you on with us. Rob Galloway, he's an A&E consultant.